Hi everybody, I'm Ezra from EzraHelps.com. I'm going to talk about cannabis, CBD, and arthritis today. You can find me on EzraHelps.com. What I do is I'm a cannabis consultant. I help people understand how to use medical marijuana. And I come at it from an approach that's a lot more holistic than just your basic go into a dispensary and buy cannabis. I really think that there's a lot to the mind-body aspect of cannabis, and I'm going to talk about that a little bit with arthritis. Because arthritis, how it manifests in the body and what it does to patients, sadly, is very well connected to how cannabis can help. So just a little bit about arthritis. What it is inflammation in the body. And it's also the degradation of the cartilage in between joints. So you have these bones that have soft tissue in between. And when that soft tissue breaks down, the bones are hitting each other. This causes lots of pain. Ailments such as osteoarthritis, this is pain and arthritis in the bones. We have rheumatoid arthritis. This is where the immune system is attacking itself. It's causing the inflammation, which can increase pain. We have things like fibromyalgia, which is a type of arthritic pain that is sort of flowing throughout the body. It's very hard to pin down. A lot of drugs and techniques and conventional medicine are used to try and combat fibromyalgia, but it's a very difficult one to treat, and a lot of people have success with using cannabis products when they're dealing with fibromyalgia. We also have things like gout and lupus. Lupus, rheumatoid arthritis, fibromyalgia, these are a whole sort of class of ailments and pain that are very difficult to treat. And we have these fancy names for them, but often the treatments for them are difficult and don't quite hit the mark. So this is where my knowledge of cannabis fits in. There's something called the endocannabinoid system. The ECS, as it's called, is the largest cell feedback system in the body. Okay, so this is all of our cells have ways of communicating and turning on and off and changing their behavior. The endocannabinoid system is the largest because it affects almost every cell in the body. It's affecting all of the immune cells, and it's affecting all the nervous system cells. We also have receptors for in the ECS, in the organs, in the bones and blood and skin and connective tissue. So the endocannabinoid system, this is the system that we're producing chemicals for. It's creating feedback in cells. The cells are communicating. What is miraculous is that when we discovered what this cannabis plant does, we discovered that all these compounds, all these chemicals in the plant actually go into the endocannabinoid system. They trigger it. They change its behavior. They tone it. They have all these amazing effects. So the two main chemicals or constituents of cannabis that we know of are THC and CBD, or not that we know of. We know of many, but they're the main ones we've studied, THC and CBD. What THC does, THC is the one that gets us high. You know, we smoke marijuana and we can feel THC in our system. It's going into the anandamide receptor sites. Anandamide is the endocannabinoid that we produce naturally. We actually produce it when we exercise. It helps to keep inflammation down. That's what anandamide does. So THC mimics anandamide, goes into our receptor sites, and it actually slows the signaling down of the nervous system. So it's bringing that intensity of the nervous system, saying ow all the time. It's bringing that intensity down. That's what THC is really good for. It is an anti-inflammatory to a certain extent, but what's really amazing is CBD. CBD is the other constituent of cannabis. It is a much more subtle molecule. THC is really felt. CBD is much less felt in the body. Some people do feel CBD, but generally it's considered to be non-psychotropic. It doesn't have a response in the body that gets us high or stoned. And what CBD does, it's primarily artivates in the immune cells, and the immune cells are what get inflamed when we have arthritis, when we have rheumatoid arthritis, especially. So all of our immune cells, our immune system is on high alert, and it thinks, oh my gosh, well, if I'm inflamed, then I'll be fighting off some disease that it believes exists. CBD goes into the system. It mimics something called 2-AG that we naturally produce. This is what we naturally produce in the endocannabinoid system. CBD goes in, mimics the 2-AG, and brings, this is proven, brings the inflammation down, makes those immune cells calm down. So CBD is different than THC. THC goes right into the cell and clicks onto the cell and has that effect. CBD is more of a toning effect. It kind of hovers on the outside of the cell and convinces or coaxes those cells to go back to a homeostasis, to go back to normal. So CBD requires a, I'm sorry, I'm adding somebody online here. If you guys have any questions while you're watching, please feel free to, hi everybody, welcome, thanks for coming. Feel free to ask questions below on the feed here. So CBD is more subtle. I think of CBD as a therapist, and the therapist is someone you go to once a week. You know, you get your talk in, and they help you, they affect you, but it's not a direct effect. It's not like going to a chiropractor where they're actually sort of forcing you to have an effect. That's more like a THC. THC is strong, direct action on the body. So THC is also good as an analgesic, bringing pain down. A lot of people who take THC into their system, even small doses. So you can take, if you know someone who has arthritis and they're afraid of using medical marijuana or worried about getting high, they should come talk to me. But they should also realize that you can take very small amounts of THC and still get pain relief from it without having cognitive changes, you know, without being affected in that way. So I think that's a great thing about that THC. THC is also mimicking anandamide, this chemical that I mentioned, we naturally produce, that we produce during exercise. And when we produce it during exercise, we get the runner's high, right? This is the elevation of mood that we get. We essentially get ourselves a little bit stoned, a little bit high when we exercise. And this is from the anandamide. This is the natural THC that we produce. So it's a great feedback loop. You can deliver THC to the system. You can bring that pain down. But here's where I think a lot of people miss the mark when we're talking about cannabis and arthritis and even conventional medicine, is this idea that we need to take a pill, right? This pill has been proven to bring inflammation down. This pill has been proven to decrease pain. Even with cannabis, people can say, oh, here, take this. It's a tablet, it's an edible, whatever it is, and that will make pain go down. Well, it's really important to remember that mood and one's state of mind has a huge impact on how we feel about our pain and how we perceive it. So if we're despondent, if we're frustrated, if our morale is really low, if we go to a doctor or even go into a dispensary where the people are like, here, just take this, you'll feel better, and we don't make a personal connection, I believe that people will not benefit as much from this, from the treatment. So if you can actually make a connection with a person, have a little more intimacy, and guide them through. Cannabis is a great way of creating a one-to-one relationship where you get to know the person who's providing you the cannabis. And that can be your favorite bud tender at a dispensary. It can be somebody like me who's a cannabis consultant. It can be your neighbor who happens to grow your cannabis and provides it for you. But when you have a conversation with that person, you ask them how they're feeling, you empathize, and you get a sense of their mood. When they feel better, when they feel connected, and when they feel hopeful, what's happening is their endocannabinoid system is already coming online. Their endocannabinoid system is trying to balance them out. It's trying to relax them. I have clients come in who are very, very frustrated with their ailments. And I spend 90 minutes with them talking about their ailments, talking about the history of their ailments, talking about their family history and their support systems. And when we can create a holistic, three-dimensional picture of the patient and then guide them through with cannabis, you don't just give them a joint to smoke. Because sometimes if people are feeling depressed, they're feeling anxious, they're feeling frustrated, their immune system is going to be on high alert. You know, if we're feeling anxious, we are worried that something's going to happen, so our immune system is more activated. Therefore, inflammation goes up. If we're depressed and sad, and if our pain is getting down, then this has been shown that people who are depressed, their pain can be more severe. So as practitioners, we have to engage with the client based on empathizing with where they are in the moment. So that's kind of my approach to interacting with clients. And then I will go in and say, all right, here's the difference between CBD and THC. THC is going to be more of a Band-Aid. It will help the pain go down, but it's not going to tone the system over time. That's where we really want to deliver CBD. Deliver CBD over a long period of time, say 30 days. And working with the dose, trying to figure out a dose that's not going to make the client too sleepy, that's not going to make them agitated, because cannabinoids can both be stimulating as well as sedative, depending on the individual, depending on how it's delivered in the system. So guiding them through, holding their hand a little bit with how to use it, and then understanding what the products do. You know, what kind of THC is it? Does it come from a flower? What kind of flower is it? Is it a sativa or indica? What are the effects on other people? These are really important things to know. And then another thing I talk about is just the very wide spectrum of ways that you can introduce cannabis to the system, CBD or THC. When we're talking about the arthritic joints, when we're talking about the arthritic body, we're essentially talking about the bones that are hitting each other, and there's that soft tissue that's getting lost in between the bones. All the cells there are completely inflamed. So you can imagine the CBD going into the cells, bringing the inflammation down. The THC goes into the nerve cells, brings the pain down, but we still have bone on bone. And that's why I really am a proponent of using oils, healthy, organic, edible oils that we infuse the cannabis into. So this is a great way of dissolving cannabinoids, which are oil-based, right? You dissolve them into a carrier oil. The carrier oil is then either ingested orally. When you ingest the oils, these oils can deliver it deeper to tissues. And so I've seen people have a better effect from ingesting oils and allowing that to occur over several weeks, where the oils are deeply penetrating tissues and finally getting down in between the bones there and providing some lubrication. So if that carrier oil, like an olive or a coconut or a sesame oil, can dissolve the cannabinoids, bring them right to that spot, and then help lubricate, then you're getting a full benefit there. I also suggest that people put the oils right on their body. So on your wrists and fingers, on your knees, the joints that are affected, because we have cannabinoids all over our bodies. We have cannabinoid receptors all over our bodies. Those receptors are going to receive the cannabinoids at the point of contact. So delivering an oil, say an olive oil or a coconut oil. I like a coconut oil that's a cooling oil, and it cools inflammation. So if we deliver that right to the knee, for example, a lot of people say, well, how is that going to help the bone way deep down inside? Remember, over time, 30-day application, it's going to slowly penetrate. That's a good thing. But what's amazing is I've observed where the oil goes directly onto the skin, and the skin has its own nervous system attached. You know, our nervous system is like a big web, a big matrix, all connected together. And when the cannabinoids first get that introduction of topical, they seem to be able to relay a pain reduction throughout the whole knee. Now, they haven't done a lot of studies on this yet. It's just what I've observed. It's also what I felt, because I can have a sore, a wrist, an injury, for example, put a cannabis oil onto it, and I can feel almost instantaneous pain relief. Now, I don't want people to go out there and just say, oh my gosh, it's a miracle drug. It's going to cure my grandma's arthritis. It's not like that for everyone. Everyone has a completely different and unique endocannabinoid system. So where one person has incredible, great response to a topical oil, I always mention my beloved 85-year-old client, Phyllis, who went through all the different opiates for her osteoarthritis in her hip, and finally settled on my cannabis oil, my CBD cannabis oil for her hip that she just put on every day. She did say it took about 30 days for it to deeply penetrate and bring the pain down. But some people will find, actually, I try it topically, it doesn't work for me, but I smoke some marijuana and it does help. Or I use a vape pen, or I take a tincture and that does help. So arthritis is difficult. It's hard to treat, but the cannabinoid system is very well situated to treat people with arthritis or inflammation and pain because of those reasons. One, our endocannabinoid system is very connected to the joints, to the nerves and the immune cells that might be inflamed. So that's really important to tone the endocannabinoid system. Cannabis is oils, and if we deliver it with oils, we're lubricating those joints, we're softening the tissue in between the joints. And third, cannabis alters our mood. It changes our mood. If we use THC, it can make us feel euphoric. We lose that depression, and then the pain feels better. If we're using CBD and it's making anxiety go down or depression come up a little bit, then the pain can be reduced through that mood aspect. So cannabis and cannabinoids cover a lot of bases. And then, of course, it's having a compassionate practitioner, a caregiver who understands the person's ailments, understands how that person responds to medication, how fearful they might be, or what kind of support systems they have around them. The act of delivering oil to a part of the body, either via a loved one or yourself, is a very loving, nurturing act. And so when we're thinking about just popping a pill for arthritis, I want people to remember that there is a deeper, more holistic and more intimate understanding that can occur that will help people's pain. So thanks for joining me on my little brief live cast on arthritis today. You can check out EzraHelps.com. If you know anyone who wants to better understand medical marijuana, wants to understand how products are used, wants to use my CBD, try the CBD, I ship it anywhere, then go to EzraHelps.com or message me, reach out to me on any of my platforms. Thanks for joining. Take care.